Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart Life as a Dad and a 35-Year Cancer Survivor, available on Amazon. This video, I think I'm just going to call the list. Now, I've talked about my being a 37-year cancer survivor now, diagnosed with Hodgkin's lymphoma at the age of 22. 37 years later, I am now 60 years old. Unfortunately, as a result of the treatments that I underwent, there are several issues that have developed, and I've mentioned in prior videos the importance of still being followed up by at least your primary care doctor. It helps if your oncologist lets your primary care doctor know what to look for. In my case, that didn't happen. I went about my merry old way for about 15 years until something went kablooey with me. And at that point, the door was opened into what we call long-term survivorship clinic. So I ended up at Memorial Sloan Kettering Cancer Center, where many tests were done on me to see how my chemotherapy and radiation therapy back in 1988 1989 impacted me. So the easiest way to do this whole sheet is filled with everything, well, pretty much everything that I was diagnosed with. Not all of it am I currently being dealt with. In other words, it's not really on the radar to do anything with currently. Things are pretty much prioritized with me. But what I'm going to do is I'm just going to rattle down the list. So again, as you're looking at me, I look, as I often refer to my shell, that I perceive looks fine, right? So I'm going to start rattling these off. I may explain a couple more in detail for time purposes with the video and really not to bore you. I'm just going to pretty much list the things that I'm dealing with. Coronary artery disease. We call that cardiac disease. So that was my left anterior descending artery, which was bypassed, and then the right coronary artery, which received a stent. Both of those two arteries are the main arteries going to the heart. I have multiple thyroid issues. That was due to radiation therapy. Also, getting credit for the radiation, I've got multiple thyroid nodules that are constantly being watched for potentially developing into thyroid cancer. Restrictive lung disease, that is courtesy of radiation and one of the chemotherapy drugs that I have. What that is, basically, the easiest way to describe it is the feelings of like having an asthma attack. Unfortunately, inhalers don't relieve that when I do get these issues. I have a cyst on my one kidney. They're not doing anything about that except for watching that. Hypothyroidism, that's as a result of the radiation. Insulin resistance, again, that's something that many of us Hodgkin's survivors have developed over the years. Hypertension, which is the fancy name for high blood pressure. Diabetes type 2, again, not something that ran in my family, but courtesy of probably my pancreas, which has not been studied, and I'm not really interested in opening that door. Valve stenosis with the aortic valve. I constantly show my little heart valve that was replaced for my aortic valve. I do still have pending issues with my mitral valve yet. I evidently am quite a freak when it comes to a murmur that I have, that whenever I'm in a doctor's office, anybody who's within reach comes in to listen to my very distinct murmur. Really should charge for that. Let's see. Carotid artery disease. Again, this is courtesy of radiation. I had to have a stent put in my left artery, left carotid artery. Toxicity of radiation throughout my body. We also call that radiation fibrosis. The inside of my chest cavity is a mess from the scarring from radiation therapy. Now this I have to read so I get it right. Mild non-proliferative diabetic retinopathy with macular edema. That is being attributed to the use of my prednisone, I believe. Macular telangiectasis of both my eyes. I do get regular eye exams every 6 months as this stuff progresses. I do notice that my vision is changing rapidly through each year. I have various immunity challenges as a result of the one staging process that I went through called the laparotomy. They removed my spleen as a result. It's been confirmed. Ironically, during COVID, I participated in a study to check how long the COVID vaccine would last, and as far as any of its impacts. And my body does not hold vaccines, which means vaccines that I received long ago, even as far as childhood, I'm probably no longer covered. And because I don't have a spleen, I'm limited with which vaccines I can take or be exposed to. For instance, I cannot be exposed to live vaccines. Made it kind of challenging when my daughters got their baby vaccines. The polio vaccine is a live vaccine, and it passes through their stool and urine. So that got me off of diaper duty for about a week. Let's see, Barrett's esophagus, which is a precancerous condition of the esophagus that I've been diagnosed with. Zenker's diverticulum, easiest way to explain that, again, that's also in here in my esophagus. I've got a loose fold of skin that has the habit of trapping particles like food and stuff, and that can create some problems with inhaling bacteria into my lungs, which twice has caused pneumonia for me. One time, even septic. Septic, it does not end well if you have it, if it's not caught in time. I have polyps in both my esophagus and my colon, which of course, polyps, if they're not removed, have the potential for turning cancer, so it's always good to remove those. I have extreme reflux. I have a hiatal hernia. I have something called dropped head syndrome, and this is courtesy of radiation damage to my neck area, where the front neck muscles that I have left actually pull my head forward, that it looks like I'm walking around depressed. It takes a lot of effort for me to keep my head up. Many of us who've had such extreme radiation, my neck still is fairly large. I had a rather round neck to begin with, but there are many who have an obvious neck that we often refer to as Hodgkin's neck. We can pretty much pick out who of us have had that radiation therapy. Osteopenia, which of course is an issue with the bones, much like its big sister, osteoporosis. Yes, men can get this. So that, again, was caused by one of the chemotherapy drugs that I took. I also have facet joint arthritis in my vertebrae from L1 through L5. That acts up every now and then. I have upper body muscle atrophy. So if I'm standing up, my arms right now are resting on the arms of my chair, but when I'm standing up, you can see actually that my right shoulder actually hangs lower than my left shoulder. And without my shirt on, we kind of call this like a chicken wing appearance. You can see there's no muscle structure in my shoulders. You know, my shoulders actually look like a chicken wing. Let's see, fatigue, pulmonary nodules. So I have several of those on both my lungs. However, I do have one nodule that has grown to the point where it's now being labeled an indolent lung carcinoma, lung cancer. And then my newest diagnosis as of this last year, myocardial ischemia, along with congestive heart failure. So it's a long list, and I've actually run out of time. So we'll talk about more of these individually in other videos. Until then, this is Paul's Heart.